with or diagnosed with tennis elbow? Is the pain starting to get more frequent and intense, keeping you from doing daily activities or working out to your fullest? Tried all of the tennis elbow braces, exercises, or even got an injection only to have the pain continue to get worse? Then this video is for you. For those of you who don't know me, my name is Dr. Maggio, and I am a chronic pain treatment expert with over 15 years of experience, specifically for neck, shoulder, and elbow pain. My focus is on finding and fixing nerves that get stuck to muscles with a glue-like substance called adhesion, also known as scar tissue, and then reducing inflammation from chronic pain naturally without the use of medications or injections. This leads to a big increase in overall functioning, flexibility, and long-lasting pain relief. Just a quick disclaimer on why I make these videos. I really make them not to entertain, but specifically for anyone who has been dealing with chronic headaches, neck, shoulder, or elbow pain for at least 6 months. They've tried just about every type of treatment, and they've been lied to, overpromised, and underdelivered by the current medical model, really in the hopes of giving some real answers as to what is going on and get to the root cause of the problem to get some long-lasting pain relief finally. Now on to the video. All right, this week's question came from Annie on LinkedIn. Let's read it. I am 36 years old and I love to stay active and play all types of sports. Recently, I got into pickleball last year, but have been having a lot of pain in my elbow that was diagnosed as tennis elbow by an orthopedic doctor. My treatment started with a round of anti-inflammatory medications for about 6 weeks, which did help the pain. But as soon as I got off them, the pain came right back. I did 3 rounds of cortisone shots, which only numbed the pain, but hurt badly getting them. I have tried 10 different types of braces, all of which did a whole lot of nothing. Before, I would just get the pain after working out hard or playing pickleball. Now I am waking up with the pain and even have it constantly throbbing when I'm working at my desk. I just had an MRI done and it came back as some moderate tendonitis, but no tears. The doctor wants to do another round of injections, and if that doesn't work, do an exploratory surgery to see what might be causing the pain. I don't like the idea of just randomly having some surgery without knowing what is wrong, but I'm running out of hope. Any insights or answers would be greatly appreciated. Thank you so much for sending that question in, Annie, and sorry to hear you're dealing with this. Just a quick reminder, if you do have a headache, neck, shoulder, elbow, I guess, and wrist problem, send me in a question. And if I think I can help, I'll make a video and help you get some real answers. All the information to do that is in the description box wherever you're consuming this video. So let's get right into it. So what am I going to cover in this video? First is why the diagnosis of tennis elbow is incomplete. Next, 3 common causes of tennis elbow that most providers miss. Common treatment methods and why they don't have long-lasting results. And lastly, how our providers approach the problem to help get long-lasting pain relief. So why the diagnosis of tennis elbow is incomplete? Really, you need what's called a tissue-specific problem to know what the true cause is. And a lot of times, if someone's just getting pain out in the lateral part of the elbow, we assume that it's just tennis elbow. It doesn't really tell us anything. It doesn't tell us the tissue. It doesn't tell us what's going on. It's one of those, I call it like a junk box diagnosis where they're just like, yep, it hurts out there. That's got to be tennis elbow. And the problem is, if you don't know what the problem is, you're not going to be able to actually fix it. So these generic diagnoses are just really done by doctors and medical providers to appease the insurance company, but then they really don't know what to do for the treatment. And then they kind of just do like a cookie cutter approach and treat everyone exactly the same, kind of like what's happening with Annie, some bracing, anti-inflammatories, injections. They're not getting to the root cause of what's really going on. Another question I always like to ask in my clients and my patients is, was there any direct trauma to the area or not? It's really important to know that. A lot of times if someone came in and like they got whacked in the elbow or they fell in the elbow or something like that, I'd expect the elbow to hurt. But a lot of times if they're getting pain in the elbow, but there wasn't any real trauma there, a lot of times I think it's a compensation and something else is going on. And a lot of times that pain presentation in the elbow is really more of the effect, but not the true cause. And lastly, I always try to look at the function of the tissue, the function of the elbow, the function of the shoulder, the neck, the wrist, as opposed to the pain. You know, so many people and so many providers focus solely just on the pain instead of actually understanding where that pain comes from. It comes to the idea, like I said earlier, the pain is really the effect, but it's not the true cause. So, the most common cause of pain, dysfunction, weakness, decreased flexibility, inflammation in the body is an accumulation of this stuff called adhesion, also known as scar tissue. Essentially, it's like a glue that gets inside the muscle and makes it really hard for everything to be able to stretch and contract. And a lot of people are like, oh, scar tissue or adhesion. How did I get that? I didn't have a direct injury. Well, a lot of times from overuse, repetitive overuse, your muscles are just constantly on. They're on all day long. And essentially, what happens is they don't get enough blood flow and oxygen, sends a signal to the brain. The brain goes, hey, what's going on here? And it starts to pump out this stuff. They're called collagen fibers that really build up muscle. But what happens is they don't have enough time to like properly finish them or cook them enough. And they send them out and they're kind of just not good things. And then it just builds up. And you can see over here on the right side here, it just looks like just a mess of everything. And it causes a lot of issues. And the first thing it does is it just makes the whole area less flexible. And then it does make it a lot weaker, but it takes time for it to kind of build up, kind of similar to like plaque on the teeth. It doesn't just happen overnight. It starts to build up. And then eventually you get a cavity and you have a way bigger problem. So the first cause of tennis elbow presentation that most providers miss is actually a nerve getting stuck. It's called the radial nerve. And the radial nerve is a really big nerve. It actually starts at the base of the neck and then makes its way down through the shoulder, through the armpit, down the arm. It helps to control a lot of muscles in the arm, especially the back part, like the tricep and things like that. But essentially, what happens is along its course, nerves are built with about 15% of like extra slack to keep them healthy. But when that adhesion builds up, eventually it gets stuck to the nerve. And when it gets stuck to the nerve, it causes some numbness, it causes some aching, some burning, some tension. And then what else happens is when the nerve is compromised or stuck, all the muscles around there, they continue to tighten up even more to protect the nerve. Because if the nerve doesn't work, nothing works. So the body will kind of sacrifice a lot of other things. It'll sacrifice the muscles, the tendons, the ligaments, the bone, the cartilage to take the pressure off of the nerve because the nerve is the number one thing it wants to protect and it's getting stuck. So it's trying to work its way around there. Next thing we start to see is what's called lateral epicondylitis. I can't even say it right. Lateral epicondylitis. Yeah, I need to practice that word. I'm not good at that. But tennis elbow. Essentially, what happens is a lot of people get diagnosed with tendonitis. And when people hear tendonitis, this is what Annie got on her MRI as well. Really, what that means is some inflammation of the tendon. But what's really going on there is something a lot worse. It's actually called a tendinosis. So a lot of people miss this. So over time, with a lot of adhesion building up and scar tissue building up in the muscles, then getting stuck to the nerve, like I said, it makes things weaker and less flexible. So the force has to go somewhere. So a lot of times it ends up going right to the tendon. And when it goes to the tendon gets really beat up and it develops this thing called a tendinosis, which is actually a degenerative component of the tendon. And those are bad. And usually what happens is they tend to feel a little bit better um, when you're actually using them and they warm up, but then they're really beat up afterwards. And then they also tend to feel really bad when you haven't used it for a while, especially when you wake up in the morning. And that's what Annie was saying. She's starting to feel it in the morning as well. The other really big problem of tendinosis is 97% of tears in tendons, be it the Achilles, be it the knee, be it the shoulder, the elbow, were actually a tendinosis to begin with. And a lot of times they're missed and they get misdiagnosed as a tendonitis. So it's not an inflammation thing, it's actually a degenerative thing. And degeneration is a really big deal because the problem with degeneration is it progressively gets worse. So knowing that you have that is really important because you can slow down the degeneration and in some situations actually reverse it a little bit after you get all the muscles and nerve entrapments cleaned up. So what are some common treatment options and why don't they have long lasting results? Number one is stretching. Stretching really just kind of pulls and tugs on the muscle. I think of stretching as like kind of brushing and flossing your teeth. But what happens is when you have that adhesion and that nerve in there built up, you're not actually getting to that deep stuff in there. You're just kind of pulling it. It temporarily feels better, relaxes it a bit, but it's not actually getting to the root cause or making a physical change or removing that adhesion or that nerve entrapment. Next is corrective exercises. You know, a lot of people end up at a physical therapist's office going through exercises to help strengthen the area. I get what they're trying to do when the muscle presents as weak, they think they need to strengthen it. But the idea is you have to understand why it's weak. It's weak because all of that adhesion and scar tissue is built up in the muscle and the nerve. So you got to get that out of there first before you could ever think to do corrective exercises. Next is anti-inflammatory medications. All they're doing is just wiping out some of that pain and that dysfunction. They're really treating, like I said, the effect, but not the true cause. It's kind of like your check engine light came on in your car, and instead of actually fixing the engine, you just turned off the check engine light. The problem's still there. And that's what they do in the medical world is they really are more symptom focused. And they're like, well, there's inflammation there. We got to get rid of it. The question you must ask and what your provider must know is why is that inflammation happening in the first place? Next is injections. I am not a fan at all of injections. Um, all they do is clear out some inflammation, but in studies, they've actually made the tendon worse. You're more likely to get ruptures in the tendon, more tears, and things like that. There's nothing good about an injection. If you want to get an injection, possibly to like get some temporary pain relief so you can let it heal. But a lot of times people are getting injections and cortisone shots done so that they can actually go back to their activity. They didn't fix anything. It's the same thing I said. It'd be like you just unhooked your check engine light and then you go out, didn't fix the engine, and then you floor it and you wonder why your engine blows up. Don't get me going on conspiracy theories of orthopedic doctors where possibly they want it to get worse so they can justify a surgery down the road. That's for another video. Next is deep tissue massage work. Yeah, it does get to some of it, but the problem is these nerve entrapments and this adhesion need a very precise and very focused treatment. A lot of times when people are getting deep tissue work, you're really just kind of beating the hell out of the tissue and it hurts and it's stimulating some stuff, but it's not actually breaking that down. Nerve entrapments need just the right amount of depth, just the right amount of tension to get a proper treatment and actually break it down. Next is bracing. Bracing helps unload the area, and it can be very useful in the treatment process as you're getting the tissue cleaned up and getting it functioning better. But once again, a lot of people just put a brace on so they can continue to do an activity where that tissue is damaged. And then if you have one of those tendinoses in there, it's going to cause an even bigger issue down the road. Next is surgery. I'm not a big fan of surgery, especially without a direct trauma, because once again, like I said, a lot of the effects that they're seeing on an MRI are more the effects, not the true cause. So a lot of times I always say, think of like the tendon damage or the bone damage or the bone spurring is like your thumb and it's stuck inside a car door. The car door is all of that adhesion. You can't give this a chance to heal up before you remove that. So a lot of times they try to fix this, but then that car door slams right again, which is why people don't have the best outcomes with surgery, especially those that didn't have a direct trauma to the area. So, how do our providers trained in the peak method address the problem to get long lasting results? First, is we start by fixing the nerve entrapment. You have to get rid of the nerve entrapment first. Like I said, everything around there is not going to move correctly because the body wants to protect that. Now, treating the nerve entrapment can be tricky because it needs just the right amount of depth, right amount of tension. It's a very fine and precise type of treatment. And most providers just kind of go in there haphazardly and just really beat the living hell out of the area. And it doesn't actually do much of anything. Next, after we do that, we clear up all the adhesion and all the surrounding muscles. We got to get all that out of there. We free up the nerve, then we free up the muscles with a specialized approach of manual based treatment. Then we're actually able to directly treat the degeneration in the tendon with an instrument where we actually can go in there and kind of scrape out and break down some of that tendinosis that builds up in there, which in turn will allow blood flow and oxygen to get back in there and give the tendon a chance to heal. Then we also do like to continue doing bracing in between visits to help give some support, not so you can do more, but Annie was talking about how she has to work at a computer. This just helps her able to do what she needs to do to survive and get through. We're not doing this. You can go out and continue to do more and more activities. We need a healing environment. Then once we get all the nerve entrapment gone, all the adhesion gone, the tendon healthy, then we get into what's called eccentric loading. It's a special type of focus exercise that helps to regenerate the tendon and build it back up. The problem, like I said, with physical therapy is they like to start there before actually cleaning up all the other stuff. And that's why they have poor results for chronic tennis elbow and getting long lasting results for it. And then after that, we focus some strength training with like some single arm work and really emphasizing some grip work. A lot of times we got to build, when we have all that adhesion there, it makes it weaker and less flexible. We get the flexibility back and then we start to build the strength. Then we need to build up the global strength too, to allow the person to handle more, be able to handle more load and kind of get back to normal life. But we have to follow all these in order If we don't, it's not going to actually get any long lasting results. So the way you go in the order is really important as well. So that's all I got for the video. If you're dealing with tennis elbow and you'd like to get some help, the best providers in the world for treating adhesion and nerve entrapments are trained in my system called the Peak Injury Treatment Method. And when you've had enough of constant elbow pain and discomfort, reach out directly to us and request a no charge pain consultation to get some real answers as to what is going on and on the path to long lasting pain relief. All of the information to request that is included in our profile or wherever you're watching this video. I appreciate you watching, and I'll catch you on the next one. Bye.